How does it work?
Sculptra is made up of polylactic acid, tiny little particles derived from fruit acids. They inject it in, your body then recognizes there's something to work on and starts to make collagen around those particles. So at first you don't see much. All you see is a little bit of swelling, which is the xylocaine, because we put xylocaine with it to make it more comfortable. After that, after 3 to 4 hours, the xylocaine goes down, the swelling's gone, you look as if you've done absolutely nothing. So there's very little downtime. Possibly a little bit of bruising, but very, very little. Then over the next month or two, 6 to 8 weeks, your body will start making the collagen. We can do it as early as 1 month, but we prefer to do the second treatment after about 6 to 8 weeks. There's no upper time limit though. If you move off to Nepal and come back, you can have another one in a year's time if you want. But it's advisable to get about 3 or 4 treatments to get the desired fill. But we can essentially keep going until we get to the amount of lift and fill that we want. And then once it's there, we hope it to last 2 to 3 years.
What's the advantage of using Sculptra?
Sculptra is both absorbable and biocompatible, meaning your body doesn't recognize it as foreign, it thinks it's part of its normal body structure. As well, it's absorbable, so even if your body doesn't actually do anything around it, the particles will eventually go away. You won't have foreign body granulometer, you won't have anything stimulating down the line, lumping and clumping. When we put Sculptra in your face, it can help to improve the overall structure of your face, sort of maintain the structure but lift up so that you get a more oval shape rather than a rounder shape. It will also help as it fills. Not only does it help the general structure, so kind of like a facelift in a bottle, but it also helps the fine lines on the surface. By gently puffing out and drawing moisture to those fine lines, they will fill out, plus the collagen that has been stimulated will help the fine lines on the surface. The placement of the Sculptra will determine where it works. By putting Sculptra into this area in the mid-face, we strengthen the jawline by straightening it, and we also fill in the hollows of the cheeks. This is a natural part of aging. We hollow in our cheeks as the cheek fat drops, and the jowls form, and that disrupts our whole jawline. So we want to pull and straighten, and this Sculptra helps us to. Your face and just draw where I want the Sculptra to go. Massage the areas 5 times a day for 5 minutes, and you'll do that for 5 days. So now for the most important part, known as the smoosh. So this is the type of pressure you have to use. You can see it's a fair bit of pressure, right? All right.